give you some more resources during this, the COVID-19 crisis. So today we're going to walk through a health summary that we have, and kind of like your health plan. We wanted to be able to bring this information to you. We know that most people will not be hospitalized from the COVID virus, but we wanted to be sure if by chance that were to happen for you, that you would have all a good health summary available that could go with you to the hospital and would have important information for you. So I think we're going to share the screen so that you can see the form, and I'm just going to talk a little bit about the form for you. And then Caitlin's going to go through some of our tips, and we're going to talk a little bit about the glossary that we have at the end. So just give Caitlin 1 second, and I think we'll get to the health form. And my husband has joined, and my dog has now gotten very excited about the presentation. So we created this health summary, and it really puts all of the important information that a person would need. So if you were had to go off to the hospital, you could give them this form. This form, you might be able to fill it out. You might need the help of a family member. It has a lot of information, your personal information, who your caregiver might be, who might be supporting you with any healthcare decisions. It talks about any current symptoms you might have for the virus. And any medical concerns that you might have that could be a complication or make the virus a little bit more difficult for you. It lets you list medications, any allergies to anything that you might have, and then it goes on to a second page, and Caitlin's just moving that up. And the second page is a little bit more specifically related to what your disability might be and what accommodations you might need. So in the way of, you might need an interpreter, you might need somebody to read things to you while you're in the hospital. They might have to explain it to you a little bit more in depth. It also talks about any equipment that you might be using or you might need to use, a communication device. It allows you to talk about ways you like to communicate with others and how you might express yourself. So how you might let somebody know that you're not feeling well, you're scared, what things you like and dislike, all important things that medical professionals might need to know. We also added if you have any sensitivity to touch. So, you know, when you end up in a hospital, a lot of people might be trying to help you, and might be good for them to know that that might be difficult for you. And now we're also, people are wearing masks. And so do you have a sensitivity to the mask? And then there's a place for additional notes. And the reason that we really wanted to put this together is we just wanted people to really be prepared if they had to go off to the hospital and not have a family member or a caregiver there. I'll give you an example. I just had a telephone medical appointment with my son just before this, and we asked his doctor about if he were to get sick and have to go to the hospital, would I be allowed to help him? We have a supported decision-making agreement, and the doctor did say that at this point, if he were to be hospitalized, that I would not be allowed to be there in person. But one of the things Caitlin's going to talk about is how to get this in your medical records. And the suggestion was to add our supported decision-making to his medical record, and that they have options to virtually communicate with family members, and that they would even be able to video conference me in if he were in the hospital, in his hospital room, so that we could hear the all the necessary information. So this is just one of those tools you can use to be able to be sure that people know about you if you're in a situation where you might have to go to the hospital. I'm going to turn it over to Caitlin, and she's going to talk about the different tips that we have on this form, and again, ways to be sure to keep yourself safe.
All right. So, like Sally said, at the beginning of this toolkit that's now on our website, there is a sheet here that's got some tips that helps keep you safe and puts a plan in place so that if you do need extra medical attention, you already have everything you need. We know that most people aren't going to need more or special treatment if from a hospital if they get COVID. A lot of people are able to get over it without needing to go to the hospital. But it's still really important to get everything you need in order now, because it's hard to think about these things when you're actually feeling sick. So this health summary is a good thing to put in a folder. A power of attorney for healthcare, if that's something that you have now, you can put that in the folder. And that's just giving somebody that you trust the option to make your medical decisions for you when you no longer have the ability to. So if it's not, it doesn't take away your power to make decisions while you are still able to. But if you were in a position where you couldn't make a decision anymore, the healthcare power of attorney lets somebody that you trust make that decision for you. So that's a good thing to have and put in your folder. And then the other thing that you should do is, if you can, put this in your electronic medical record like Sally was talking about. So if you use something like MyChart, these forms are things that you can include in there and attach so that any doctor who pulls up your record is able to see them, and you don't have to worry about having them on hand when you go to get medical care. And the accommodations and things you can list on the form, or if you have a different way of tracking your accommodations, you can use that. And that's all things that you can do now before you get sick. Then there are some things that you should do if you start to feel sick, and that's just to keep you safe and to keep the people that you live with or who support you safe. And a lot of those tips we talk about in our larger COVID-19 resource toolkit, about staying away from people, keeping 6 feet away, or if you're sick, staying in your room or staying someplace where no other people are, washing your hands a lot, those kinds of things. And then there are things that you should do if you have to go to the hospital because you are feeling too sick to stay home and you think you're going to need some extra attention and care. And that's like packing your ID, packing your devices or your communication devices, your clothes, things like that, so that you have things at the hospital that you might need, as well as all these forms that we talked about before that you got ready, and then talking to the people about who can come with you to the hospital, how far they're allowed to come with you, and what ways they can support you, even if you have to go maybe into the room by yourself. Sally, I think, mentioned that you can maybe have somebody come virtually with you if they can't come with you physically. So those are some of the tips. I didn't go over all of them, but they're listed on this form. And they've got little check boxes. So if you want, you can print this form out or download it and just check the boxes off as you get all these things ready. And that way you know that you're as prepared as you can be in the rare case that you need more help to get over COVID-19 than normal. All right, Shannon, did I forget anything?
No, I think you covered it well. Thanks, Caitlin. I mean, I think, you know, the idea is there's things you can do now that you can just be prepared for, whether or not you're feeling sick or not. You want to make sure that you have your ducks in a row. If you have plants at home or pets or kids, you know what I mean? You talk to people about who's going to take care of those if you know, something does happen, and just making sure you have everything in order before, you know, if if anything actually does happen. But again, many people who get sick, don't need special medical care, but it's important to have this stuff put together if you do need to go to the hospital. So as with everything that the Board for People with Developmental Disabilities does, we ran this through, ran it by a number of self-advocates to get their input from people first. And, one of the things that we heard was that self-advocates really need to know that's complex information. And so for people to really know and understand, this healthcare summary, that we needed to put together a glossary of terms and definitions for self-advocates. And so the Words to Know, this glossary walks people through important things like what's a triage policy. So the form mentions that you should find out what your hospital's triage policy is, and in the glossary it says it explains that a triage policy is how a hospital makes decisions about who's treated first. There's the explanation around quarantine, powers of attorney, emergency medical records, and whatnot. So we may be adding a few more. We got some more feedback, so we may be adding a few more definitions to this glossary, so that way self-advocates can be empowered to really understand the information and be in charge of it when they're putting this together. So Sally, were there any questions on the Facebook?
So there was just there weren't too many questions, but if anybody's watching and they have a question, post it in the comments. We are monitoring that. I did see someone ask a question about where to find this form. And so we will, you can find any of the Toolkit forms at the BPD webpage, and that's WI-BPDD.org. And we will also put the link in the Facebook Live when it finishes. We'll get the link in there. Caitlin may be adding it to the comments as we go. It is at the bottom. So there are, oh, see, Caitlin's pulling it up for us.
Great.
So we have not only this form, but we have our stay healthy, stay safe, and stay connected. And then also our safer at home. So we've created a lot of different tools for people with disabilities to really feel prepared during this crisis. We also will have a few videos, the self-determination channel. So that's the self-advocates have been doing different presentations, and they're in the process of filming a couple more to explain our safer at home form, and that should be up in the next couple days. And besides that, I don't see any other questions, but we will monitor the Facebook, and so if people have questions after, we'll make sure to be looking and providing any updates in the comments. Anything else?
Yeah, I think the other thing is, if you want to, you can sign up on the website to get emails from us. So that's from BPDD in general, and that the information for that is on the website. And one of the things that we're going to plan to do in the next couple of days is send out kind of an email with all the links, all of the videos in it. So it's kind of like a whole thing. So if you sign up on the website now, we'll be able to see your email address and send you all of it in one big package. So everything is on the website if you want to find it.
All right, that's great. Well, we're going to sign off for now and look forward, because we keep coming up with new materials and for everyone, and we'll be back on Facebook Live if we do that.
Great. Thanks.
Bye. Stay safe, everyone.